Ça fait la quatrième hospitalisation. C'est la première fois. Oui, c'est la première fois ici. We are in intensive care units where we take care of all the severe cases of the hospital, especially children. Yeah, here, all the severe cases who need close follow-up from the nurse and medical doctor. It's in this room that we're taking care of them. This is one of my baby here who was admitted today during the morning with severe pneumonia, and we are suspecting that maybe he have also a genetic malformation, but we cannot diagnose that here in Amtiman. So it's only a suspicion of this genetic malformation. So I'm going now to try to check his lung with my stethoscope just to see how it's going now. I still have a lot of crepitation on his lung, so we're going to follow up with him here. And then tomorrow, if he's getting better, we're going to send him to the normal pediatric ward.
So many of these patients should have come before?
Yeah, should have come before, but as they are far from here and they don't have a health structure with near them, so they prefer sometimes to start by traditional healer before to come to the hospital. It's just here in Amtman where we have doctors.
So can you tell me where we are now?
So here we are in the nutrition wards where we hospitalize the malnourished kids. People here often they are farmers and they go to do their work far from here, Then they stay there with all the family, and then after to do the work there, after 2 or 3 months, then they come back here. So most of the time they come with severe cases. Salam alaikum marazena. Kikef? Non, je voulais. Kikef al bébé? Afia. Masabiba. Often they remove the cannula. They remove this cannula that we put there.
Okay.
So to not allow them to remove it, that's why you put this bandage on the hand. But it's not because they are sick for that. We just don't want them to remove every time the cannula and the nasogastric tube. So sometimes they just remove it, and it's a lot of job to put it again. That's why we just put it here so that they cannot remove it. Il a fait combien de fois de diarrhée? Il a été admis aujourd'hui, hein?
Oui, c'est une admission d'aujourd'hui.
Okay. Yeah, he have also diarrhea and vomiting, but we're just trying to give him what they call resomal. Resomal is a type of water that we give to malnourished kids. Malnourished kids don't get the normal water. That's why we try first to give this one, and then afterwards we reevaluate after this liquid and see if we can pass to oral one or we continue with this one.